Hello everyone, my name is Adeswa Uni, the stepped up nurse. I'm a registered nurse, I'm a registered midwife, I'm a bachelor degree holder, and I'm a master's degree holder in public health, right? I backed my bachelor's degree in nursing some years back, and last year I bagged my master's degree in public health. I'm happy to announce to you that I'm founder of Pregnancy Support Foundation, and Pregnancy Support Foundation is a non-governmental organization, right? An NGO that started about 4 years ago in 2021, right? And then what we do is to give support to pregnant women, and we started on social media. We moved on from social media to expand further to touch people that don't have phones, people that are not on social media, right? Yes. By doing that, we had to start free medical outreaches, right, to people that are deep inside the communities in area of low socioeconomic status. So we started this in December 2021, and we just had one outreach, two outreaches, but last year we started to have monthly outreaches, right? During the outreaches, we carry out health education, we do screening for the pregnant women, we check their blood pressure, we check their blood sugar, and then we check their urine to carry out urinalysis to check for protein and to be sure that they are not heading towards preeclampsia or eclampsia. And then by God's grace, we've been able to help a lot of pregnant women gain insight into their pregnancy health. So this year we decided to inculcate training, that's empowerment of women and pregnant women and women that are not pregnant, that's women of childbearing age in general. We even involved secondary school students in Kaduna State, right? So we've been going around from state to state. Last year we covered Kaduna State, Abuja, Ekiti, Ondo, Osun, Oyo, Lagos. And in Lagos we had 2 outreaches, in Ekiti we had 3 outreaches, right? In Ekiti we have 2 outreaches, in Ondo we have 3 outreaches, and it's been really amazing. Now Kaduna we have had more than 5 outreaches together. We've also gone to Jigawa State and Kano State, and this month we are going to Kebbi State. So we are actually planning to go round and stretch on to the eastern states and the southern states too. So this has officially made us to launch, because people have been asking that, okay, when are you coming to my state, when are you coming to my state? It's like, how we divide ourselves into 4 states at the same time? Everybody's craving for this month, everybody's craving for that month. So we decided to launch the nationwide medical outreach, in which different states will be able to launch their medical outreaches nearly at once. So we begin the planning from this moment. Immediately you watch this video, the planning has begun. And if you are a health professional, you have the opportunity to be a coordinator for your state, right? If you are not a coordinator, you can be an assistant coordinator and work with the coordinator for that state. So the prerequisite for being a coordinator is to have strong interest in public health, right, impacting the health of pregnant women and women in general, and then have an interest in helping people. Number 3, be interested in community participation and community mobilization, right, to get people to attend these medical outreaches. Now there's no pressure. What we need for your medical outreach in your location to hold is just 20 women. So if you have 20 women, if you have 40 women, if you have 100 women, your outreach can hold. All you just need to do is create awareness. Now talking about venue, this outreach can hold anywhere, right? It can hold in a community, in the Seriki Palace, right, in the Chief's Palace. It can hold in your compound if you have a big enough compound to house 20, 30, 50 women, right? That is fine enough, right? And then it can hold in a church, right? All you just need to do is to get our letter, and then you give the letter to get the community or the pastor of the church or what have you, so that we can get permission to have that outreach, invite the women, and then do the health education, the health screening, and then the empowerment, which is the empowerment is major to train them how to make reusable parts, right? We started in January training women on how to make parts that can be reused. You make it, you use it, you disinfect it such that it will not cause infections for you, and then you continue to use it like that. So we want to train them on how to make it themselves, so that they will not have to go through the mental struggle of raising funds every month to buy parts, right? There are lots of families in Nigeria that don't even have money to keep on buying parts, and some families have 3 girls, 4 girls, five young ladies to cater for, and a lot of people are jobless, they don't have funds to do this thing. So this is our own way of coming in to help a lot of women out there, especially in the community. So training will be done for all the coordinators on how to do this, and coordinators are expected to onboard one tailor in their team, at least one tailor, or somebody that knows how to sew well, to be a part of the team, so that it will help the training process for people that will be coordinating the training. So one person can train 20 women, right? But if you have 2-3 volunteers for pregnancy support, right, or 2-3 volunteers, because we are partnering with another organization called Pregnancy and Beyond, so we are working together to bring this to you all across Nigeria. So you would actually be wearing t-shirts, and there will be banners, right? You will have a banner behind you. The fundraising will be done by each state, by each community, by each state. So each coordinator is to handle the fundraising. And what will the fund be used for? You don't actually need much. Between now and November, you can plan your event. So your event can hold in November, in October, or in December. Anytime you are ready, your event can hold in your own state, right? As long as fund has been raised and everything has been settled. The fund is only needed for the t-shirts that the volunteers will wear, and for the refreshment that will be given to the women, and then for the materials that will be used for the sewing, right? Because 3 major materials are needed, including the sewing materials, right? The needle and the thread and all of them. But if you want to train your participants to sew with a machine, that's also fine. You can actually go to a tailor and sew it, and then start using it every month. You have saved them cost at least, right, for a year or 2 before that particular part gets bad and they need to make another set. And it can be an empowerment in which they can actually make the parts and resell, package and resell, as long as it passes through the appropriate channel for it to be used officially by people, right? So photograph sessions will be taken, will be carried out, and videos will also be recorded, so that we'll be sure that this outreach actually helped, right? And then for now, we will be picking coordinators. So if you are a part of our platform, you would have seen the message already. But if you are not a part, if you are a nurse or you are a health professional, you can onboard and be trained on how to make this part, and be trained on how to deliver the health talk, because there will be one person that would deliver the health talk, which has to be a nurse or a midwife, and then a few persons to carry out the training. So the women will be divided into a group of 15 women, or a group of 10 women, or a group of 20 women, right? So if you have 4 volunteers, you can have many groups, right? You divide the women so that they will be able to see what you are training them on creating, that is the reusable part. A video will be sent to train people, and then a whole month will be dedicated to training coordinators on how to make this reusable part. But the most important thing you need to ensure during your outreach is to make sure that health education is done, and the health education focuses on teaching pregnant women about pregnancy health, about the importance of antenatal screening, antenatal care, and then the importance of using their drugs and eating healthy in pregnancy, and then the kind of support we give at Pregnancy Support Foundation, which is spiritual support, physical support, psychological support, and social support. Don't worry, the training will be done and everything will go seamlessly. The outreach is a 1-day outreach, so let everybody know that after that 1 day they are totally free to continue their lives, right? In the year 2026, we will have another repetition. It will be a yearly program. But if you want to have the program every 2 months or every 3 months in your own location, that's totally fine by us, right? Well, we need to start right away, and we are going to all the 36 states of Nigeria. So if you live in any state and you're watching this video, please sign up to be a volunteer coordinator, right away, or sign up to be an assistant coordinator or a member of the team of volunteers, right? To be a part of the team of volunteers for Pregnancy Support Foundation or Pregnancy and Beyond, you don't need to be a health professional, right? So anybody can be a volunteer. Cheers to making impact in the lives of women in Nigeria. Once again, congratulations on your onboarding and on your impacting in the lives of women.